Good morning. My name is Deepika. I am IT manager of this project. I am a student of Big Data Analytics in Georgian College and I will present the first part of this PPT which is introduction and objective. Let's begin with agenda of this PPT. Our project is heart disease prevention. In this PPT, we will give light on introduction of project, objective, process visualization, analysis plan, ethics and management plan, and the final phases, which is implementation. Let's start with introduction. Bill Gates Foundation is creating a report for the Canadian Ministry of Health to detect the occurrence of heart diseases in different age groups working in different professions. Using the report as a reference, the Ministry of Health would like to check whether awareness programs and campaigns are enough to spread knowledge about heart diseases and their reasons. As per the background of the topic, people nowadays do not care about their health and compromise blindly and adopt unhealthy habits to a greater extent. As a result, heart disease is becoming more common among people and death rates are rising as serious outcome. That's why government decides to initiate this project to bring awareness and change into society. There are many people who are unnecessarily suffering and dying from heart disease because they are under researched, underdiagnosed, undertreated, and underspotted during recovery. We will analyze disease incident data collected from open data and WHO, that is World Health Organization, between 2010 and 2020. We will compare the heart disease incidents by different attributes: sex, age, family, medical history, and race. We will provide insights into a new and a better understanding of heart health and awareness for prior prevention. The client requested a report with data visualization depicting the causes of heart disease occurrence, including indicators such as the gender of the patient and age group. Next is project objectives. Objective of a project plays a very important role. Let's start with objectives. The goal of this project is to develop a data analysis report for the Ministry of Health and Heart Care Hospitals as giving awareness to citizens about heart diseases. The report will assist the user to do the following: examine the incidence of different heart patients based on different age groups, races, professions, and so on. Examine heart disease incidence trends. Based on the report, develop campaign and awareness programs. The goal of this project is to develop a data analysis report for the Ministry of Health and Healthcare Hospitals as giving awareness to citizens about heart diseases. The report will assist the user to do examine the incidence of different heart patients based on different age group, races, profession, and so on. Examine heart disease incidence trends. Based on the report, develop campaigns and awareness program. Data analysis, data visualization, advice, heart diseases prevention campaigns to the government are in our project scope. Process of inspecting, cleansing, transforming, and modeling data with the goal of discovering useful information or extracting information that will meet our final result is included in data analysis phase. After this, we will present a visualization which will entirely based on data analysis phase. On the basis of the final visualization, we will advise heart disease prevention campaigns and different programs to the government and our project company, which is AAR Groups and Bill Gates. Creation of a website, advice on the use of funds, and offer medical treatment related to the heart conditions are out of the scope because we will not deal with all of these things. Amritpal Singh will give a brief description about outcomes and other topic of our project. Thank you so much.
Uh, my name is Amritpal Singh. I am a data analyst in this project. Firstly, I discuss about outcomes of project. The study significantly advanced our understanding of how to change the lifestyle, improving the quality of life for patients today and for countless other in the future. Secondly, according to data analysis, the government could set up more programs for high-risk patients. In other words, it would help patients in crisis and enable more funding for research for those with the highest risk. Delivery of the report to public can increase public awareness about heart diseases. The report will enable readers to learn more about cardiovascular diseases and their reason. People will become more aware of the methods for preventing heart diseases, which may help to lower the risk of developing the condition either early in life or later in life. Next slide is about business process visualization. There are mainly five stages in this process: collect and search data, preparation and data analysis, visualization, forecasting, and report. Firstly, we start with collect and search data. In the first step, we gather the client requirements and gather data. And after completing that, we will checking of the data valid or not. If no, then we again start the process from beginning. If yes, then we go to next step. It is about cleaning of data. After cleaning of data, we will check data validation. If yes, then we do analysis of data. If no, then we do again cleaning of data. After analysis of data, we will submit midterm report to client. After submission, we will wait for approval. If yes, then we start preparing for visual and chart. If no, then analysis of data. After completing the preparation for visual and charts, then we do forecasting of result and start preparing final report for clients. After preparing final report and then submit to client, we will wait for approval from client. If yes, then it is the end of the process. If no, then we start again from preparing visuals and charts. So this is the end of the business and process visualization. In the next slide is about data analysis plan. There are mainly four key milestones: collect and search data, preparation, data analysis, data validation. Firstly, I start with collect and search data. Firstly, we need to collect and get data from the client. It must include all the requirements of client. We can also call this as a requirement analysis phase. Moreover, we need to extract the patient detail from different distributed databases like hospitals, insurance centers, and and after completing this process, the next step is about preparation. The preparation is all about data cleaning and filtering. Here we will use Python for the same. In the next step is about data analysis. In this phase, we roughly analyze the data which we cleaned at the previous step. For this purpose, different tools are available like Python and Excel. A brief report will be generated at the end of this phase. Visualization of data. The purpose of visualization is to give a quick overview of the data and to explore some of the relationship in the data. Here we will use Python, Excel, and Power BI. If we need any other tool to do data visualization that would suit the client requirement, then we also use that like Tableau and many others. And the next slides will be discussed by my colleague Amandeep Kaur.
I am Amandeep Kaur and I am working on this project as a communicator. At first, Here I am going to explain about ethics and data management plan, why we introduced ethics and data management plan in the project. It helps to avoid conflicts of interest between individuals by prioritizing the interest of stakeholders and the organization. The first and the most important ethic for the project is NDA, that is non disclosure agreement. It is for more assurance and privacy and also acceptable to the client and adhere to its conditions. Company usually do this agreement for not to disclose the confidential information to the third party. Second one, all the original data and other information entrusted to us is stored in a secure location such as SharePoint and will remain unaltered throughout the timeline. All information sharing is secured from potential risk using encrypted channels through SharePoint. Moreover, we will check and recheck our research for quality, accuracy, completeness, and integrity before presentation to maintain the validity and credibility of the results. The other one. For more clearance, we will do validation and management of data based on our observations, conclusions, recommendations, and decision making, which will make our project more efficient and demanding. The last one. We will be extra careful so that no unethical data handling will occur, which is considered as unethical conduct and might be harmful for the company as well as for the project, so that's why we will be more careful about that. All our workstations are protected by a password that is unknown to anyone other than the assigned user. No one has access to our workstations, including colleagues and even our family members and friends. So it was all about the ethics and data management plan. With this, we will be able to secure our confidential information for the well-being of the company and the project. Next is process timeline. We have prepared this timeline with the time period of 4 months, that is from September to December, and our whole team is responsible and gave a contribution to the project and have completed and going to complete the remaining stated task according to the timeline. As you can see, here are the 4 tables and we have categorized those tables into some colorful blocks that are green, orange and the gray. Green represents that the work is done, that is in the first table. Orange represent that we are working on it, that is in the second table. And the last 2 tables, that are November and December, contains the gray block, which represents that we are going to complete the remaining task in the upcoming future. In this table, we also mention all dates of the particular task from starting to the end, which have made our work more easier to complete all the tasks on the time. And this process timeline have made our project more representable. Last but not the least, we have our project budget. Project budget, which is the main aspect to be considered even, we divided it into several phases that are requirements, design, development, testing, release and the total budget. And we have other 4 columns too, that are percentage of the total budget, the working hours, weeks and the budget. As you can see on the screen that we have 2 pie charts. We have made this pie chart to make the criteria more easy, and we can see that development have covered the highest percentage of total budget and release have covered the lowest budget in the whole pie chart for the total budget. Thank you. This is the ending of our project. Thank you.